Hello everyone. Welcome to you all to our pediatrics university question answer discussion. In this video, I'm going to discuss about the disorders related to kidney and the urinary tract. Some of the important question is asked in this topic. So, a question is like that. First question is a few year old male child presented with edema around the eyes. A 5-year-old male child presented with edema around the eyes, which progressed to generalized edema in few days. He had normal urine output. Urine examination showed heavy proteinuria but no hematuria. And another question is 4-year-old child present with the puffiness of face, swelling all over the body and decreased urine output. What is the most probable diagnosis? How will you clinically evaluate and manage the child? And another question is a 3-year-old male child is diagnosed to have the minimal change nephrotic syndrome. Discuss the pathogenesis, clinical features, and management of the same. And what is your most probable diagnosis? Write about the pathogenesis of the condition. List down the essential investigations and expected findings. How will you manage the child within the hospital? So these all questions are the features are pointing towards the nephrotic syndrome. That is, first of all, the child, that is the age of the child, which can be if the less than 3 years, that is a congenital nephrotic syndrome, and greater than 3 years, it can be also nephrotic syndrome. And also, there is a there is a puffiness of face or the around the eyes. There will be swelling. That is indicative of there is a chance of the renal disease, not any cardiac or any liver disease. And the puffiness of face or the swelling around the eyes is indicative of the renal disease. And another important feature in this question is regarding there will be showed heavy proteinuria but no hematuria. If there is hematuria is present, that is indicative of the nephritis syndrome. But here there will be showed heavy proteinuria but no hematuria. That is indicative of the nephrotic syndrome. That is more features suggestive of the nephrotic syndrome in this question. So we have the diagnosis as nephrotic syndrome. That is all regarding the questions, and it is commonly asked as an essay question. So we should learn in details. And also short essays are describe etiology, clinical features, and management of nephrotic syndrome in children. And that short answers us discuss the management of the first episode of nephrotic syndrome like this. So these are the questions regarding the nephrotic syndrome. So we should learn in details. First, about the diagnostic criteria for the, that is definition of the nephrotic syndrome. First is there are 4 criteria for the diagnosis of the nephrotic syndrome. All these 4 criteria should be satisfied to define the nephrotic syndrome. That is, first one is the proteinuria. That is, it is nephrotic range proteinuria or massive protein. Proteinuria also happens in the case of nephritic syndrome also, but that is not massive proteinuria or nephrotic range proteinuria. It is only the nephrotic range or the massive proteinuria happens in the case of nephrotic syndrome only. And the massive proteinuria is defined by 3 methods. That is, first is by the protein excretion of the urine is greater than 40 milligram per meter square. That is one criteria. And the urine protein creatinine ratio is greater than 2. That is another. And the urine dipstick shows 3 plus 4 plus proteinuria. That is all indicative of the nephrotic range proteinuria, the massive proteinuria. So that should be satisfied to define the proteinuria. Then next criteria is hyperlipidemia. That is, we have serum cholesterol greater than 200 milligram per deciliter. Then hypoalbuminemia should be the, that is the serum albumin less than 2.5 gram per deciliter. Then another criteria is the edema or anasarca. So all these 4 criteria should be satisfied to define the nephrotic syndrome. And about then, nextly, in the question also asked as a regarding the classification of nephrotic syndrome. So it can be classified based on the histopathological, etiological, and according to response to treatment. Histopathologically, it can be classified into minimal change nephrotic syndrome, that is contribute to 70 to 80%, and others like focal segmental glomerulosclerosis, membranous nephropathy, membranous proliferative glomerular nephrosis type 1 and 2. So that is all regarding the histopathological classification of nephrotic syndrome. And then we have the etiological classification, that is idiopathic. The first classification is idiopathic or the primary, that constitute mostly. And the secondary also happens because of infections in the case of 10% of cases. And also drugs causes the nephrotic syndrome. And also Drugs like NSAIDs, penicillamine, and rifampicin, and can also cause the. This is the one more question. What are the drugs which causes the nephrotic syndrome? The drugs like NSAIDs, then penicillamine, and rifampicin. These are all contribute to the nephrotic syndrome. Then immunological disorders like SLE also leads to secondary nephrotic syndrome. So that is all regarding the etiological classification. Then about the according to response to treatment, there will be two classification, that is steroid sensitive nephrotic syndrome and steroid resistant nephrotic syndrome. The steroid, that is usual treatment response, is called the steroid sensitive nephrotic syndrome, and it can be again classified into frequent relapser, infrequent relapser, and steroid dependent nephrotic syndrome. That is all regarding the classification of the nephrotic syndrome. Then about the pathophysiology of the nephrotic syndrome, it is also asked as a sub question in the essay question. So about the pathophysiology, usually all the symptoms of the nephrotic syndrome is because of the leakage of proteins uh, uh, into the urine, and that results in the hyperproteinemia, and that causes the fluid leaks out of the blood vessel causing edema. So that is the ultimate final outcome of the nephrotic syndrome. That is because of this leakage of proteins, there will be loss of proteins in the blood that causes the fluid leaks out of the blood vessel causing edema. So that is the ultimate mechanism. But the first initiative mechanism is regarding the glomerular basement membrane. That is, we usually have a glomerular basement membrane to protect the to act as a barrier for the passage of high molecular weight substances usually. So, but if there is any change in the glomerular basement membrane, that is, if there is an increase in the size of micropores on the glomerular basement membrane, or the loss of negative charge on the glomerular basement membrane, that is usually the high molecular weight substance have the negative charge. So this will be repelling of the negative charge of substance with the glomerular basement membrane negative charge. So there will be no chance for the leakage of proteins through the urine. So the high molecular weight through the urine. But if there is any loss of negative charge on the glomerular basement membrane or increase the size of micropores of GFM, that results in the or that allows the passage of negatively charged albumin, that is high molecular weight, into the urine. Therefore, there will be loss of proteins in the urine, and these proteins may be lost as in the form of antithrombin 3 or lipoprotein lipase that results in the hyperlipidemia and thrombosis. And the protein loss is because of the loss of albumin in the urine, that is results in the hypoalbuminuria, that results in the edema. And also the protein loss is as in the case as immunoglobulins. Therefore, loss of immunoglobulin results in the infection. Also the fluid act as a good culture medium, so also edema which contributes to infection also. That is all regarding the pathophysiology, and all initiates from this changes in the glomerular membrane, that is basement membrane, that is either negative charge is lost or the size of micropores on GBMS increases. That results in the passage of negatively charged or the high molecular weight substances into the urine, and that results in all the signs and symptoms or the complications of the nephrotic syndrome. So hypoalbuminemia, how the edema happens is that there will be hypoalbuminemia that causes the decreased intravascular oncotic pressure. That is, most of the oncotic pressure is contributed by the albumin. So because for decreased albumin in the albumin which causes the decreased oncotic pressure, so that will causes the fluid shift extravascularly. That is from the vessels, the fluid is shifted extravascularly, and that results in the salt to water retention. That results in the edema, and also because of this fluid shift, there will be hypovolemia that causes the renin-angiotensin aldosterone activation, that cause the ADs release, that cause the water and salt to water retention, that again leads to edema. So that is the mechanism of the causation of edema in the case of nephrotic syndrome. That is all regarding this. So that is all about the pathophysiology behind the nephrotic syndrome. Then about the clinical features, it is also asked as a sub question in the essay question. So age, idiopathic nephrotic syndrome is have usually most common in the 2 to 8 years of age. Uncommon presentation are the congenital nephrotic syndrome. If this happens less than 3 months, it is called the congenital nephrotic syndrome. And 3 to 12 months, it is called the infantile nephrotic syndrome. And 1 to 2 years, it is called the early onset nephrotic syndrome. And greater than 8 years, it is called the late onset nephrotic syndrome. And the chief presenting symptoms are the patient is present with the renal edema. That is, it is more in the morning and decreased by evening, beginning on the face. That is in the we discussed in the question that usually in every question of regarding the nephrotic syndrome, there will be features like there will be presence of edema around the eyelid or in the face. No? So the renal edema which begins on the face being acute, fluid first gets collected in the most low subcutaneous tissue in the body, which is in the eyes. Then later abdominal wall edema, genital edema, and ascites and pleural effusion happens. Anasarca after a few days in an otherwise happy or non-toxic child, and the child becomes very happy. That is all regarding the renal edema. That is one of the clinical presenting symptom in the case of the nephrotic child. Other presenting symptoms are the mild